And I'm going to turn the floor over to Ms. Beth Froeba, who's our Assistant Director of Student Affairs at our Hammond area campus, to cover tobacco awareness.
Good morning, everybody. I have several different things to talk to you about in terms of tobacco. We're going to talk a little bit about cigarettes, and then we're going to talk about tobacco cessation, that's quitting smoking. And then I've got a little added bonus. We're going to talk a little bit about vaping, because sometimes people don't necessarily think of smoking as vaping, and there are some risk factors there. So we're going to touch on those a little bit as well. So I'm going to share my screen and we're going to get started. All right, so I've got some fast facts for you that I just wanted you to know. They come from the CDC. Just some basic information about tobacco, just so you understand why we have this in our Wellness Week. Tobacco use is the leading cause of preventable disease, disability, and death in the U.S. Basically, when you start talking about different diseases and reasons people die, some of the leading causes of death are related to heart disease and lung disease and cancer. And when you look at tobacco, some of the top 3 diseases that show a direct correlation are some forms of cancer, heart disease and stroke, and lung disease. It also has some, it also impacts diabetes. I was actually a surprise to me when I was researching this, because I didn't know it impacted diabetes. So if you have a loved one who's diabetic, or you're diabetic and you smoke, you actually can be impacting your health an extra way. And of course, there's also pregnancy complications, to include premature birth, low birth weight, and certain birth defects. 34 million US adults smoke cigarettes, and every day 1,600 people under the age of 18 try a cigarette. And of those 1,800, 2 of them become regular smokers. And a regular smoker from the CDC was someone who smokes daily. So I thought that was kind of interesting that that amount of people actually decide to do that. Smoking does cause more than 480,000 deaths annually. And what's really disturbing, it's not just that we're losing 500,000 individuals due to their cigarette habit. For every person that dies, there are 30 more people that are living with a cigarette-related disease. And we're going to watch a video in a minute, and she talks about emphysema. And I think it's really important towards the end of the video that you listen to what she says about emphysema, because emphysema is one of the few illnesses that if you smoke for a while and then decide to stop, you don't have the rebuilding of your body the way your lungs can rebuild in other areas. So I thought that was kind of interesting, and I wanted to make sure that I called your attention to it when we got to that point. So let's learn a little bit about what happens to your lungs when you smoke. I'm going to swap this over because we're going to watch a short video from the American Lung Association.
Welcome to our demonstration, The Effects of Smoking on Lung Health. I'm Jennifer Hobbs-Folkenroth, Freedom from Smoking Master Trainer with the American Lung Association. Today, I'll show you the impact smoking has on lung health. We will be comparing a non-smoker's lung with a smoker's lung. First thing you're going to see is the healthy pink color.
We can't see the video, Beth.
The way it should look.
Oh, you can't?
Your lung has 2 sides.
Hold on just a second. I'm going to stop it and start it over. I don't know why it isn't showing it to you. Let me stop my sharing.
Make sure you unshare and reshare.
Yeah, that's probably what I did. That's probably what I clicked wrong. Let me fix it. Share again. Sorry about that, guys. I thought it was showing it to you because I could see it. Can you see it now? All right, let's start over. Let me move you guys so I can do what I need to do on my side. And now you can't hear it because the share changed. Pause. I'm going to be able to hear it in just a second. Should work now.
Roth, Freedom from Smoking Master Trainer with the American Lung Association. Today, I'll show you the impact smoking has on lung health. We will be comparing a non-smoker's lung with a smoker's lung. First thing you're going to see is the healthy pink color, exactly the way it should look. Your lung has two sides, the right side of the lung and the left side of the lung. The right side is larger and includes two lobes. Let's take a moment and see what it looks like when a healthy non-smoker's lung takes in a breath. When you breathe, you have millions of little air sacs in the lung called alveoli. These little air sacs fill up with vital oxygen to carry it through the bloodstream throughout the body and deliver it to your various organs. This is a very healthy non-smoker. The size, the shape, the function is exactly what it should be. Now I'd like to take a moment and compare this to a smoker's lung. What's the first difference that you notice between these two? The color. So the smoker's lung, as you can see, has a blackened color. It's not that healthy pink glow of that of the non-smoker. Why the black color? It's all about the tar. At 1 pack per day in 1 year, 1 full cup of tar is filtered throughout your lungs. Multiply that by how many years you've smoked, let's say 1 pack per years. Now you've had 20 full cups of tar that have filtered through your lungs. Now we'll take a moment and see what it looks like when the smoker breathes. What's the next difference that you see in comparison? This lower portion here. So the lower right portion of this lung is no longer taking in any vital oxygen for the body. It has completely been shut off due to the damage from all of the tar, as well as over 7,000 chemicals and toxic poisons from cigarette smoke. Another difference? You may notice this tumor. This is an example of lung cancer. Now you will see that it is I've been asked a really great question over the years from various patients. They'd say, Jen, why can't you just go into surgery and have that cut out and be cleared? The problem? In more than 87% of cases, by the time lung cancer is diagnosed, body. Another difference you may see is how abnormal this other lobe is. So it would be smaller than the right. However, in this instance, it is larger. The reason? It is trying to make up for the areas that have been lost due to the smoking on the right portion of the lung. Now we'll take a moment and compare the two. So I'm going to pump both the non-smoker's lung as well as the smoker's lung. Now just imagine walking from your car to the grocery store, walking up a flight of stairs, doing simple day-to-day activities. Imagine doing those with a healthy non-smoker's lung. Doing those same activities is much more strenuous and challenging with the smoker's lung. Another thing I would like to show you, in the smoker's lung, there are these little porous holes. Those are where those air sacs we talked about earlier have now burst open. With each puff you take off of a cigarette, you pop those air sacs. And unfortunately, that's the only tobacco-related illness that's not reversible. It's called emphysema. Think about it. At 8 to 10 puffs per cigarette, you're popping up to 200 air sacs in a day at 1 pack per day. The good news, everything else is reversible once you quit. You can clean out the rest of that tar. You can improve your lung function up to 30% just in the first few weeks. What's important to know? It's never too late to quit. The American Lung Association firmly believes every tobacco user can quit. We know it's not easy, and that's why the Lung Association is here to provide you with the support and resources to obtain and maintain a tobacco-free lifestyle. The American Lung Association's Freedom from Smoking is a proven effective smoking cessation clinic program which has successfully helped smokers quit for more than 40 years.
I'm going to stop it right there because we're going to talk about cessation programs, and there is actually a freedom from smoking in the local area that you can join through one of the hospitals. But I just wanted y'all to see the lungs. What's really interesting is in Hammond, we actually have that same setup that you saw her use. Those are pig's lungs because pig's lungs are closest to the lungs, human lungs, so that they can be a demonstration. She had gloves on because they're actually being, oh my gosh, the word is hit me and I can't say it. They're being preserved, excuse me. So they're being preserved. So they're actually in a liquid solution that would be harmful. Gloves on her. They really look like that up close. So most of the time when we do this on our campus during the year, we put those out and we let the students pump up the lungs and watch them. So I wanted you guys to have that visual. I wanted you to be able to see what it looks like. So we're going to go on back to the next part of what we were talking about. So now we're going to talk a little bit about, let me go from front slide. We're going to go on and say, I know it's harmful, but how do you stop? How do I stop? A lot of people struggle with stopping smoking. I have a friend who will tell you that she's quit 15 times, and the 15th time was the charm. So it's not an easy thing to quit. I've read studies. I don't have the exact study, but I've read articles and studies that say it's as addictive, if not nicotine is as addictive, it's not more addictive than say heroin or cocaine, because you're more likely if you try it to continue to use it. So with that said, we're going to talk about some strategies to quit from the Mayo Clinic, and then we're going to talk a little bit more about some more details about other things. So the first thing they recommend is writing down your reasons for quitting and referring to them. Why is that important? If you, in that moment, when you really want a cigarette, if you can't remember why you want that cigarette, it helps to have that handy so you can remind yourself. So put it as a note in your phone. Don't just write it and keep it at the house. It also reminds you why you're doing what you're doing. And it's a goal. And every goal, when written down with a clear objective, you're more likely to reach because you can't justify it away as you go through your everyday. The next thing is to make a plan. Plan when you're going to quit. Plan how you're going to quit, and plan what that looks like. How are you going to adjust in situations when you want to smoke? I think a lot of times we say we really want to do it, but we never write the plan of how we're going to get there. And when you don't write a plan, the minute you have a setback, you have something that happens, you don't know how you're going to adjust for it. So plan for the hard parts of quitting. Consider other ways to quit. The Mayo Clinic is referring to the fact that a lot of people think the only way to quit smoking is just to stop. That is not beneficial for a lot of people. Remember the friend I just said who said she's quit 15 times? She finally quit when she started backing down and went from a pack a day to half a pack a day. And then from a half a pack a day to 3 cigarettes a day, and from 3 cigarettes to 1 a day, until she could actually step completely out. So I think that's important that you consider other ways to quit. And also consider using resources. There are people who can put the cigarettes down and walk away from them and fight their cravings as they go, but those people aren't the norm. Those people have a different, are just built in a way that they can do that. Not everybody's built that way. So figure out who you are and work on making a plan to quit that works for you. I think that's probably the hardest part, is owning who you are in this process. You know, I'm not the person who's gonna be able to just put it down and walk away. I like my cigarettes, so I'm gonna have to say I'm gonna allow myself this many this week. Talk to your doctor about treatments before you use any kind of chemical to help you quit. Before you do any of the things that I'm recommending, it's imperative that you talk to your doctor. Your doctor is going to be able to talk to you about the pros and cons of quitting, of the different cessation ways that you can quit, and about treatments that can work for you. And it's better that you talk to them because they know the rest of your health history. It might not be beneficial for you to use nicotine gum, even though you can buy it without a prescription. So have a conversation with your doctor about that. Find a counseling service. That's where the American Lung Association's Freedom from Smoking, as well as a few other organizations that we're going to talk about in a little while, come in play. These are support groups, and they are people who are there to walk you through and be a listening ear when it's really hard to quit. So find that counseling service that works for you. Talk to them about what your goals are, talk to them about how they help, and just make sure you use your critical thinking skills. Make sure that it looks like it's a proven way to work. Number 6, tell your family and friends. How many times have you known someone who's giving up some kind of vice? It doesn't matter what it is. It isn't just smoking. They get angry. They get irritable. They have a day or two when they just don't want to be bothered with people because there's some issues, with your mood. So tell your family and friends what you're doing. They'll be patient with you when you're having a rough day because you're trying to give up smoking. Manage your stress. We're going to have a session later on this week about stress management. If you want to quit smoking, I highly recommend that you attend that one too. It's already hard to make a life change. It's even harder to make a life change under stress. And right now we're all under stress. And so it's very important that you learn how to manage your stress before you decide to quit smoking. Manage what causes you the stress. Because if you can manage your stress, then in that moment when something comes at you, you're able to cope with it in a way that's not grabbing a cigarette. Because while smoking is not my choice, it's not something I've chosen to do, I know that there are certain things that I choose to do when I'm stressed. And so if you know that when you're stressed, you go for a cigarette, make sure you manage that. Make sure you find other ways to manage your stress before you quit, because that's going to help you. And celebrate your successes. If you go a day and you're a pack-a-day smoker and you only have 10 cigarettes that day, cheer. If you only have 2 cigarettes that day, cheer even louder. But even little successes are better than not celebrating it. You've got to celebrate the small stuff, or you can't be all or nothing. If you're all or nothing, you're going to give up. You've got to celebrate the small things. So you've got to celebrate the little successes. I'm down 2 cigarettes from yesterday. Or I had a really stressful moment, and instead of going outside, I actually stopped for a minute and I took a deep breath and I used a different coping mechanism and I avoided that cigarette. That's a success. And don't judge successes by being completely smoke-free at the beginning. That can help. There are various things that can help. In fact, some of the tobacco money in the settlements that the states pulled years ago pay for it, so it doesn't cost you anything. There are quit lines and online resources that can offer you support. The online resources, a lot of the ones that you can trust, are coming from well-known, reputable organizations like the American Heart Association, the American Lung Association, the American Cancer Society. Start with those places first, and then look at local reputable charities that have taken United Way funds to do that as well. And the reason I say that is you want to go somewhere where the people that are going to help you are using evidence-based treatments and evidence-based care. So, and what it means to be evidence-based means that they've done some research. They're not just deciding that this is going to work. They've done research in the program. They've looked at how it's helped, how many people it's helped, what percentage of people it helps. They've changed the program if something doesn't work for people. There's some research behind it, and you want that. You want some research behind it before you try something, especially when you're talking about your health. And you, of course, want to talk to your healthcare provider as well. There is a Louisiana Quit line that you can call, and they are available to you. It's 1-800-QUIT-NOW. There are staff available to work with you that are trained in working with tobacco cessation. They'll talk to you about ways that you can quit. They'll refer you to programs in your area. There are programs in the area. I did not put them all up because I couldn't find them in every parish, and I thought it would be better to do the 1-800-QUIT line for you guys to start, so you get a human being and you're not just digging and looking. The Auctioner Health System, as well as the St. Tammany Parish Hospital Health System, they both partner with the American program that you can join, and they're both free. The tobacco lawsuits also pay for anyone who was smoking before 1988. So if you know someone who was smoking prior to 1988, they have free cessation offered to them. So anybody in their 40s or 50s, it might be worth asking them if they want to quit, or if you're in your 40s or 50s and want to quit, it would definitely be worth asking if they started before 1988. And since most people start before they're 18, I know that technically in 1988 I could have been a smoker. You know, I was old enough to be wise enough and savvy enough to go find what I needed if I wanted it. So it's definitely important that you share that message if you're not a smoker yourself. Even if you're not in that age bracket, they do still have free programs because the American Lung Association does sponsor them. So there is these private programs. Some of them do charge, so you also want to ask those questions, and you also want to make sure that they're evidence-based. I'm repeating that because, you know, I would want to know how many people it's worked for before, and I think you should ask that question too, because if you're wanting to quit smoking, you want to make sure you're using something that's going to help you. And not every solution is going to be right for every person. I think that was one of the things that was very interesting to me as I was reading this, how many different ways you can get to the end result. And I think it's because there are people who can just walk away, and there are people who need a lot more time to work through it. Here are the medicines that are available for you if you wanted to use a medicine, some kind of chemical treatment to help you do this. The first is nicotine gum or lozenges. This is actually this gum you see at the store, at the pharmacy, you can pick up and buy yourself. You need to follow the actual instructions. Every one of them has a different rule by how many you take a day and how you use it when you put it in your mouth. And it gives you the nicotine fix so that you don't go for the cigarette. It's basically replacement therapy. The same is for the nicotine patch, and that's a patch that slowly releases nicotine. You do need to follow the parameters on that too. The patch comes in different, as does the gum and the lozenges. They come in different levels, and you buy different levels depending on how many cigarettes you're still smoking. So you phase down with it. It's kind of like a step down program. And both of those you can buy without a prescription. They do have instructions. I would still encourage you to, before you jump in and do something like that, just make sure that you know all the facts, and definitely read all the instructions so that you don't make yourself sick. The next thing is a nicotine spray. This was actually news to me as I was learning about this. There is a nasal spray, just like you think of an allergy nasal spray, and it gives you a spray. It actually includes nicotine in it, and you can only get it through your doctor. It's a prescription spray. And it's for the same purpose as the gum and the patch. It's just to release some nicotine in your system as you're slowly weaning off of the cigarettes. The last is that there's medication that is not nicotine-based, and it's prescription medication. A lot of these medicines are used for depression as well, so it's very important that you have a conversation with your doctor about side effects. The most common when you hear smokers being prescribed is Wellbutrin. And basically what it does is it helps you cope with the cravings, so that you can actually step away from the cigarettes a different way. It doesn't give you nicotine. It helps you cope with the chemical reactions in your brain so that you can reduce your cravings. So what about vaping? So we've talked about cigarettes quite a bit. So I wanted to bring up vaping because every time I do this presentation, I have at least 3 or 4 students come up to me and say, well, I don't smoke, I vape. And so I did some research on vaping, and John Hopkins has a really great handout on it. If you guys want it, if you send me an email at beth@northshorecollege.edu, I'll send you the link so that you can go in there and look at it. But there's a really great article that was reviewed by a physician, and he makes these 5 points about vaping that I think are important. Vaping is less harmful than smoking, but it's not safe. A lot of people assume that what you're seeing in the vape is water, and until I did my own research and learned, I kind of assumed it was water. The general public think what they're seeing because it looks like the water vapor, that they're seeing water vapor, but it's not. It's actually an aerosol. So basically you're breathing in an aerosol and with all these chemicals in it, and you're breathing back an aerosol. So that's where it's safer, but it's not necessarily safe because you are still getting chemicals. You're just not getting the same number of chemicals you're getting in a cigarette. Do not modify your product or purchase any product that's been modified with THC or any other substance, because those are the situations where people are actually going to the hospital and you hear stories about the people who were vaping who all of a sudden have this major lung damage. The physician in this article points out that it's usually when it's been modified, or especially if it's been modified with THC. They're adding extra chemicals, and one of the chemicals is vitamin E, and that's actually toughening up the lungs, and so the lungs aren't able to do what it needs to do, and it's adding extra. I don't like the word mucus, but extra stuff in there that makes the lungs not be able to perform. Then, oops, I hit the wrong button. My bad. The research is still ongoing, so we can tell you it's more harmful than cigarettes, but we really don't know. We haven't really had vape products ever very long. So, but what we do know is that nicotine is still in the vaping solution, and nicotine is toxic. And the physician used the word toxic, so I kept. It increases your blood pressure, it spikes your adrenaline, it's addictive. So there are things that the nicotine is doing that harms your body. You might not be getting all those 700 chemicals that are in the cigarettes, but you're still getting some chemicals in that aerosol spray. And we don't know what those chemicals are going to do to you because we don't have any long-term proof. Remember we talked about evidence-based research? The reason the physicians aren't saying what it's going to do is because they're using evidence-based research, which means they've got to have some time to see harm. And so they're warning that there's still harm, but we just don't know what it is yet. Some people use e-cigarettes are just as addictive as regular ones. In fact, they may be more so addictive. And here's why. You're getting nicotine, but you can control the nicotine. You can adjust how much you're getting of the juice, and you can adjust it and get yourself more nicotine. In fact, there are some, I think Juul has been recognized and known for actually adding more nicotine to their actual mixture. So because you can adjust the e-cig and actually pull more in, you can get more, and it can make it more addictive. So it could be harder to quit if you decide you want to quit. And e-cigarettes aren't the best cessation tool. This physician was very clear that it's not the best cessation tool. And because they feel harmless, we have a whole new generation of individuals. Remember we talked about how you typically start smoking before that, we have 1,600 people trying it before they're 18. We have a whole new generation of people who are using an e-cig, and it doesn't burn the same way, it doesn't feel the same way, and they know it is less chemical, so they think it's safer. So we've got a whole new generation that are becoming addicted to nicotine. So I think that that's really important, that while an e-cigarette is more safe, and it probably feels cleaner, it's still a chemical in your body, and you're still going to cause harm. It's still going to cause you harm. It just may not cause you harm at the same level. So I do have a resource page, and I'll be happy to share that with anybody who wants to email me about it. But now I'd really like to open it up to you guys for questions. I talk fast, so I'm a little faster than I thought I would be. But I really wanted to give you guys some time to ask questions. So we're going to open the chat, and you can message any questions that you may have, and I'll be happy to help you.
You guys, I've also added Beth's email in the chat so that if you would like that information, you can shoot her an email, but feel free to type any questions that you may have at this time.
Oh, and let me add something. It's in your handbook, but vaping is considered smoking just as much as cigarettes. And every semester I have to, when we are not socially isolated like we are right now, but when we aren't socially distancing, I have to explain that to at least 1 or 2 students. So if you are a smoker on this call, please know that you can't vape on campus any more than you can smoke a cigarette on campus. It's got the same rules and regulations.
Okay. I don't see any questions coming through on the chat. All right, so I'm gonna give Dr. Wainwright a moment to speak at this time.
Thank you, Dr. Montgomery. She just had the power to mute me and unmute me, so that's it's a good power to have. I want to thank you, Dr. Montgomery and Ms. Froeba for kicking off our Wellness Week this week on a topic that, if you look at the cancer rates tied to smoking and what it's done to generations of families, it's just, you cannot deny the data. I know we didn't go into great detail on it, but we also know that the effects of secondhand smoke on especially children and others, and you know, as we're in a pandemic, I want to believe that many of us are really focused on just our overall health and wellness, and so I just want to encourage our college family, our students, faculty, and staff to know that if as a result of today's meeting or of recent events involving the pandemic and, you know, the focus on your health and wellness, if you need help, you have it. You've got a college family that, you know, we do not judge individuals that smoke cigarettes. We actually want to support those individuals in kicking the habit, and anything we can do to be a part of that journey, please allow us through education and resources to help you all with that. So great job, Ms. Froeba. I truly appreciate the data. I want to thank everybody who took the time today. I know I learned a lot, and I can speak from, you know, from a personal level. Cigarette smoking has had a major impact on our family through loss of life and illness. And so I really appreciate the information that was provided and the investment in our college family based on today's presentation. Thank you.
Thank you, Dr. Wainwright. Beth, you got one question that just came through on the chat. So what about smokeless tobacco? Isn't it just as harmful as cigarettes and other forms of tobacco?
It is, and I apologize, I didn't include it. For some reason, it just didn't dawn on me to include it. Basically, with smokeless tobacco, you find a lot of cancers of the mouth, and it's the same addiction. Nicotine is nicotine is nicotine. So if it has nicotine in it, you're going to have an addictive quality either way. But when you use smokeless tobacco, you're actually harming the interior of your mouth. There's chemicals in it as well to preserve it, and it will sit in your, when it sits in your mouth like that, you will have some problems there.
Okay, that question was from Melanie. Thank you very much. Any other questions before we end the presentation? If not, I'm going to, before we get off, I have 2 items that I just want to share with you guys to make you all aware of some of the things that we have going on coming up here soon. So I'm going to pull those up really quickly. Okay, let me share my screen here. Okay, so the first, you guys should be able to see a flyer here. We're going to be having a town hall meeting on October the 8th with our chancellor, Dr. Wainwright, just to basically answer student questions. You know, with everything going on right now with the pandemic and so many things with social justice and all of those, challenges that have been presented here recently, Dr. Wainwright expressed to me that he wanted to just take some time to speak with our students to gauge where they are, and then to answer questions. So I did send an email out to, I'm going to send this flyer out to students, basically promoting the event, but also requesting questions. So students will be able to send us questions prior to the meeting, and then we'll try to answer as many of those as we can. And then if we have time at the end of the meeting, we will answer some additional questions. So for the students who are on, if there have been some burning questions or some things that have been challenging for you, please make sure that you email me those questions so that we can have that good dialogue with our leader on that day. Also, any faculty and staff, make sure that you're promoting it with your students that you see, because we really want to hear from them to, number one, provide support, but to also make sure that we are meeting their needs and hearing their voices and pointing them in the right direction. So that's one thing for you all to be aware of. And then one other piece I want to share with you all. As we were preparing for Wellness Week, we found that in our Learning Commons, there are several health and wellness resources. So I'm putting this flyer up, but I'm actually going to email this out to the student body and to the faculty and staff, because our Learning Commons, again, has yet another resource that we find every day, so many additional things that our Learning Commons can provide that you wouldn't think about. And so they do have several resources that will help with topics that are related to health and wellness. So I will send this out to you guys in email so that you will have those resources, and the entire student body and faculty and staff will receive this handout this week as well. Okay. All right. I don't see any other questions. Thank you all for attending. Thank you, Ms. Froeba, for your presentation and for being thorough with your presentation. And thank you all for engaging during this presentation. And we hope to see you again today, again this week, today, tomorrow, and Thursday. These presentations will be 12 o'clock and 3 o'clock. So hopefully we will see you back at 3 this afternoon as we continue our Wellness Week. Okay?
Thank you,
Y'all
everybody.
have an awesome day.
Bye.